Welcome to our video about gum bleeding disease. If you notice your gums are bleeding and are not sure what to do, it is important to visit your primary care provider. A physical exam and blood test can help determine the cause of gum bleeding disease. Treatment options will vary depending on the cause. Listed below are some home remedies for bleeding gums. If none of these remedies help, it is likely that your gums are healthy and just need to be cleaned. Your primary care provider will determine which treatment is necessary. Early stage gum disease. You should see your dentist if you have bleeding gums. Early stage gum disease is often treatable. If it isn't, you may want to consider other causes of bleeding gums. Some common causes of gum bleeding include tooth care issues, certain medications, and even a hormonal imbalance. Thankfully, you can minimize your risk by understanding the causes of bleeding gums and how to prevent them. Keep reading for tips on how to prevent bleeding gums and how to find out if they are related to your health. If you notice red, dark, or puffy gums, you may have early stage gum disease. If your gums are sensitive to your toothbrush or toothpaste, it is possible that you may have this disease. While minor sensitivity is not cause for alarm, if your gums are sensitive to your toothbrush or toothpaste, you should see a dentist. Early stage gum bleeding disease can be difficult to detect without a dental x-ray. Several factors can cause bleeding gums, including aggressive brushing or poor oral hygiene. Poor oral hygiene can lead to inflammation of gums, causing red, swollen, and painful gums. While you may not experience bleeding gums at this early stage, proper oral hygiene can help prevent this problem from progressing further. In addition to improving your gums' health, you can also improve your overall health by improving your oral hygiene habits. If your gums become infected, they can form an abscess. An abscess is an abnormal pocket in between your teeth that contains pus. This infection can be painful and even lead to the loss of a tooth. It is also important to maintain good oral hygiene and see a dentist as soon as possible. In addition to a bleeding gum, you may have loose teeth, crooked teeth, and improper dental appliances. If left untreated, early stage gum bleeding disease can lead to mild periodontitis. Once the gums are retracted, they create tiny pockets between your teeth, making the gums more vulnerable to harmful bacteria. In addition to bleeding, the gums can become loose and move, and you can lose your teeth. Fortunately, there are ways to treat early stage gum bleeding disease. While it's never too late to treat bleeding gums, it can be costly and can cause severe dental problems. In addition to treating the symptoms of gum disease, it's important to remember that this condition is often reversible. With proper oral hygiene, you can reverse its effects and reclaim your healthy smile. Regular dental checkups and regular brushing can help prevent gum disease and bleeds. A healthy diet is also vital to bone and gum tissue. With these tips, you can prevent gum disease from starting in the first place. Home remedies for bleeding gums. You can try a few home remedies for bleeding gums to ease the condition and stop the blood from gushing from your gums. You can also try ginger, which is known for its antibacterial and anti-inflammatory properties. You can also try aloe vera, which has antimicrobial properties and is known to be effective in curing gum diseases. Apply the gel to your gums twice daily to get the maximum benefit. Ice packs are a great way to relieve minor mouth injuries and the pain and swelling that comes with gingivitis. Use ice packs for about 10 minutes, and remember to take breaks every 10 minutes or so. If bleeding persists, call your doctor for a consultation. Antibacterial mouthwash is also an effective treatment for bleeding gums. The antibacterial properties of mouthwash help to reduce inflammation and pain. Many mouthwashes have hydrogen peroxide and chlorhexidine as their active ingredients. Tea made from trifala is effective in curing gum bleeding. The tea has homeostatic and astringent properties. It can be gargled or swished around the mouth several times a day to stop the blood and heal the gums. Eating raw apples and pears also helps to restore the health of the gums. Using these home remedies for bleeding gums will reduce the pain and help to stop the bleeding. Apart from avoiding tobacco products, consuming a diet rich in vitamins C and K will help in the fight against gum infections. Vitamin K can also help in the healing of gingivitis. A lack of vitamin K can lead to easy bleeding. And, reducing stress is another good way to improve oral health. While these home remedies are not proven to cure bleeding gums, they can help you relieve the pain and inflammation caused by gingivitis. Another popular home remedy for bleeding gums is coconut oil. Coconut oil contains antibacterial and anti-inflammatory properties that can fight plaque and inflammation. After using coconut oil for several times a day, you will notice a significant improvement in your gums. If the bleeding gums are caused by bacteria, you can even use tea tree oil, which has antimicrobial and anti-inflammatory properties. You just need to use a teaspoon of it for about 15 minutes every day. In addition to the home remedies for bleeding gums, you can also visit a dentist for a dental checkup. Bleeding gums are a common symptom of gum disease and can be prevented by improving your oral hygiene. It is important to brush and floss your teeth at least twice a day, as this will help remove plaque that lies underneath the gum line and lead to gingivitis. The bleeding gums may be a sign of more serious problems. Treatment options. There are several different treatment options for gum bleeding disease, each with their own advantages and disadvantages. One of the most effective, yet least common, is grafting. This procedure encourages bone growth where it is needed most and replaces missing gum tissue. The surgeon will use synthetic bone taken from a donor site to reinforce the affected area. In some cases, tissue-stimulating proteins are added to the graft, too. Other than the specialized procedures available at your local dentist's office, you can also treat the underlying causes of gum bleeding. Your diet plays an important role in your oral health, so drinking 3 to 4 cups of green tea daily is an excellent way to protect your teeth. But if you don't have dental insurance, there are still some options. You can visit dental schools for hands-on training. Hygienists and dentists also conduct clinics under the supervision of a licensed dentist. Federally funded health centers offer low-cost dental services based on your income. In some cases, the bleeding gums are caused by loose dentures. If your dentures are loose, they may cause a bleeding gum and leave your mouth open to infections. Another common cause of bleeding gums is plaque, a sticky layer of bacteria that sticks to the teeth. This buildup irritates the gums and results in redness, inflammation, and bleeding. For some people, plaque is a sign of gingivitis. If you have bleeding gums, you may have a vitamin deficiency or have another underlying health issue. Vitamin C is an effective antioxidant that strengthens connective tissue and protects the gum lining. You should aim for 65 to 90 milligrams of vitamin C each day. Vitamin K, another essential vitamin, is also helpful in relieving bleeding gums. Vitamin K helps the blood clot, and a deficiency can make the bleeding worse. However, you need to visit a doctor if you experience any of these symptoms. Non-surgical treatment for gum disease depends on the severity and type of gum disease. Deep cleaning is usually the first step. Sometimes, scaling and root planing is necessary to remove tartar and plaque from the teeth. In some cases, the gums need to be smoothed over the tooth roots to promote healing. Sometimes, the patient's bite needs to be adjusted. These procedures can be painful, and may not be appropriate for all patients. Another option for gum bleeding disease is home remedies. A good home remedy to reduce the pain and inflammation is a cold compress or ice pack. These are great for minor injuries, but bleeding gums should not be neglected. Using antibacterial mouthwash regularly can help prevent gingivitis or bleeding gums by killing harmful bacteria in the mouth. Another option is mouthwash, which can be purchased online or in your local pharmacy. Thanks for watching. Please like, comment and subscribe.